Toronto Star. I'm Raju Mudhar, and this matters. The fight to find a vaccine for COVID-19 is underway around the world. That process started with scientists isolating strains of the COVID-19 virus so that other researchers could start the path toward creating new tests for this disease and get going on the long road to a vaccine. In Canada, a team made up of scientists from Sunnybrook Hospital, the University of Toronto, and McMaster University all worked together to isolate strains to help kickstart that process. Today, we're talking with Dr. Karen Mossman, Professor of Pathology and Molecular Medicine and Vice President of Research at McMaster University, who was part of that joint effort. To talk about what that entailed, what makes this virus unique, some of the challenges of creating a vaccine, and the things that are giving her hope in these unprecedented times. Dr. Mossman, thank you so much for being with us, giving us the benefit of your expertise.
Thank you for having me.
Dr. Mossman, I wanted to talk to you because you were involved in isolating the COVID-19 virus and reproducing it along with research scientists from Sunnybrook and the University of Toronto. Can you tell us a little bit about how that team came together and exactly what it entailed?
So it was actually a very interesting organic conversation between one of the researchers, Dr. Samira Mubareka, and a postdoctoral fellow in my lab, Aaron J. Banerjee, who were meeting for a completely different reason, talking about one of the conferences that unfortunately has now been canceled, but talking about organizing a conference. And Dr. Mubareka had mentioned that they had one of the first positive cases in Toronto at Sunnybrook Hospital. And Aaron J., somewhat not jokingly, but somewhat suggested, well, you should swab that patient and maybe we can harvest the virus, which really got them thinking that that's actually a great idea and that would be strategic so that we can move forward in the fight against this particular virus.
Was there a breakthrough moment with this?
It was really interesting because on a Friday, they had some of the samples and how they were trying to do this was culturing in animal cells, a particular type of cell line that we use often to culture viruses. But again, because we don't know a lot about this virus, it wasn't immediately clear how easy it would be to actually culture or to grow the virus. And so they added the patient samples to the cell culture on a Friday. And then when they came back in on the Monday to look at the cells, they noticed that they were all rounded, floating, and dying. And I think that was the moment when was the I think we might actually have harvested the patient samples. So that was a really exciting Monday morning.
Yay, all the cells are dying.
Yay, the cells are dying, absolutely.
You know, there are several strains of the virus that have been isolated around the world, but I believe the big benefit to this is it helps Canadian scientists conduct research. Is that correct?
Absolutely. Well, it's both. You know, the more information we can get on independent patient isolates, not just within one geographical location, but also in many geographical locations, from the sequence alone, as these viruses are isolated both in time and in geography, we can start to learn more about the virus, how it's changing, how it's evolving over time. But it's also very important not just from understanding how the virus is changing potentially over time and its spread, but specifically within Canada, the ability to have multiple patient samples that were harvested here in Canada will now facilitate research across the country for a number of labs that have the right type of containment facility to enable to do a whole plethora of different types of research projects.
Can you tell me a little bit about those? I mean, are they underway right now, or is it too soon, or what's happening?
So some are already underway. We're starting to grow up the virus and understand how it grows in human cells, the kinetics of its growth, and researchers will start across the country now working with the virus. And in many cases, they've already started just with the sequence of the virus, even without having the full live virus. Certainly with the sequence of the virus, they can start working on vaccines against specific parts of the virus, so that's been ongoing. But having the live virus will now really facilitate a whole number of different research projects, either in really just understanding the biology of the virus, in trying to establish new potential therapeutics, either vaccines for preventative measures or other types of antivirals for patients that have unfortunately come down with COVID-19, and approaches to potentially help treat those patients. So there's a number of different projects that are now going on across the country. I mean, indeed around the world, but across the country with the availability of multiple different patient strains.
From your perspective, what is different about COVID-19?
So there are a number of coronaviruses that are human coronaviruses that naturally infect humans that have been in the human population for a very, very long time. Normal human coronaviruses are responsible for low-lying respiratory infections or when you get a cold every year. And so the new coronavirus isn't actually that much different. It's just that it, like the original SARS coronavirus and like the MERS, the Middle Eastern Respiratory Syndrome coronavirus, when they come from another animal and jump in from one animal into humans, the problem is humans haven't seen that particular virus. So even though the original SARS, this new COVID-19 SARS and MERS, even though they're coronaviruses and they're not that different from human coronaviruses, because they've never until now been in the human population, we don't have any protective mechanisms against them. We don't have any immunity against them. And so that's why these viruses now can spread so quickly and cause disease in humans.
Obviously, the question a lot of us have is about potential vaccines. There are reports that they might be a year to a year and a half out. Can you tell us a bit about the process of making them and what's next?
So there are different types of vaccines that you can make. And it's hard to know up front what type of vaccine is going to be the best for any particular type of infection. So there are some vaccines that we call subunit vaccines where you are making a vaccine against just one part of the virus. I mean, you're hoping that you know enough about the virus that you can make a vaccine against a part of the virus that the immune system would easily see. There's been a lot of research moving forward on that because you don't need to have the live virus to make that type of vaccine. You just have to have the sequence and have an understanding of the different proteins that the particular virus can make. There's also other type of vaccines that are live attenuated vaccines or inactivated vaccines, where you take the entire virus and you basically kill it or inactivate it, and then you use that as a vaccine. So there's many different types of vaccines. We need to try and to see which is going to work the best. It's really challenging to know up front which type of vaccine strategy is going to be the most optimal or which one is going to work until we actually do the testing and trying. And so that's why it takes quite a while to get a new vaccine, and it's not something we can just do overnight. And then, of course, there's the whole safety aspect. Before you can make any vaccine in large quantities and put them directly into patients, there's a lot of testing to make sure that not only do they work, but that they're safe and that they're effective. So it is a trial and error. It does, require a lot of work, but this is why there's multiple labs around the world that are working on trying to make a vaccine, and they're all taking different approaches to doing that.
There's a ton of stories out there, lots of news about efforts. Is there anything that has you particularly excited? Also, the other aspect of this is, what should we as lay people think about when we're reading this stuff? It's
true, and what we're hearing and what we're learning from countries that have been heavily exposed to the virus but are now at the other end of, when we say flatten the curve, and at the other end of the curve, such as China, where we've heard that, China has had their first day with no new infections. What we're really learning and what the public really has to be aware of is all of the approaches that public health are talking about social distancing, about washing your hands, really do work. And there are some great examples and some great data coming out of countries where they have implemented those policies, even if they seem very strict, and where they haven't. So the public really should take that to heart, in that all of the directives of the social distancing, the self-isolation if required, those really are important. And that's really what the data from countries that have been a couple of weeks or months ahead of us, China and Europe, we can certainly learn from that.
What do you think people should keep in mind when they are reading reports about the scientific efforts in the media?
I've heard some very interesting stories that have certainly been debunked about you can tell if you are infected if you hold your breath for a certain length of time. There have been a lot of stories how this is a respiratory tract infection and how individuals that have pre-existing conditions, particularly, in their lungs and breathing problems, and that is very true. And those are the patients that we see having the most challenges when they do get infected. Having said that, these sort of homemade tricks of holding your breath obviously don't work because it's much more complicated than that. In general, it's true that it's the elderly that are the most highly affected. That's in part because as you age, your immune system wanes and your immune system isn't as strong. It's also true that, the elderly population does have more underlying conditions involved with their respiratory tract and their lungs. So it is that combination that is really putting the elderly the most at risk because this is a respiratory infection. Having said that, does that mean that other, healthy young people can't get infected? They can. They're likely not to have the same underlying symptoms because they are not as likely to have underlying health problems, especially associated with their lungs, and their immune systems are much stronger. But people need to know that even if you catch the virus and you either don't get really sick or you don't really have any symptoms beyond what you might think is just, a normal cold, maybe allergies, you could still be infectious and you could still be spreading the virus. And so this is why understanding that even when you're healthy, you can still be infected and you can potentially still be spreading the virus even if you don't have all of the symptoms. This is really where the social distancing and whatnot happens. So it's hard to say exactly who will get sick and who will have we can say things very, very generally, but of course there's always exceptions to the rule.
Back to the research, what's next for you in terms of with the virus, or are you working on other things as well?
So for now, this is certainly going to be a huge focus in our lab. In particular, what our lab is really interested in, and one of the angles that we are going to go after is we've been very, very interested in bats. And the reason we're very interested in bats is because bats can harbor a whole number of different viruses, but they don't get sick. And bats are mammals. Their immune system is very similar to our immune system. And yet they can be infected with a whole number of different viruses, coronaviruses, Ebola viruses, a lot of these viruses that can be very, very detrimental to humans, but they don't get sick and they show no signs of disease. So we've become really, really interested in how is the immune system of a bat, which is a mammal, how is that different from the human immune system? And what we've been starting to learn is there are very, very small, subtle differences, very small. And so what we're starting to really pay attention to and trying to work out are what are these small differences, and can we effectively change a human immune system into a bat immune system? And so we've been able to discover individual amino acids in a single protein, that if we change that and make the human protein look like a bat protein, it can now be much more resilient to a viral infection. So that's a particular line of research that we're really interested in our lab, because the more we can understand how bats protect themselves and deal with these virus infections, we can come up with therapeutic strategies to basically allow the human immune system to look like a bat immune system and really understand how do these bats protect themselves against the virus so that we can use those strategies for humans. So that's a particular area of research that we've become very, very interested in.
That's really interesting because one of the first sort of viral videos that went out about this virus, one of the ones that was big misinformation was regarding a bat from one of the markets and sort of that. So I don't know if you ever saw that. It'd be really interesting or perhaps ironic if that would help us come to the solution to this. I'm not sure if you saw that at all.
I've certainly heard, and there's certainly been for a number of different, even, when the original SARS pandemic happened in 2003, and certainly with MERS, coronavirus, and Ebola, and a number, it's not clear if they originated in bats or if bats are just a carrier. And of course, bats are prevalent. There are thousands of different species of bats, so it's one of the most diverse mammalian orders. And so they really are quite fascinating. And, whether it's a direct from bats into humans is not clear. It's often, from bats into other animals and then into humans. But it's profoundly interesting that they can be infected with so many different species of viruses, and yet they don't get sick. So there is a lot that we can learn from bats, but I certainly, bats are so important in our ecology and as pollinators that I certainly don't want people to get the impression that they're bad, because they certainly, do a lot of good for the environment and for ecology. And I think they'll hold a lot of really neat information and tricks, and we can actually learn a lot about, how to fight viral infections from bats. So it is an area that, we find absolutely fascinating.
It sounds fascinating. Is there anything else that you think we or our audience should know?
I think you should know that it's been absolutely amazing to me how the community has come together. We see this not just in the scientific community, where normally people are quite protective about the research. They think about how to commercialize their research, how to patent their research. So there's normally a lot of protection around the research. In this case, definitely the greater good has been shining through. There's been a lot of sharing of information, not just, within labs within Canada, but internationally, people that are willing to put their research and their findings out in the public so that it gets out as quickly as possible so everyone can learn from that, which of course will prevent them from ever patenting it and getting any commercial value out of that. And we're seeing not just in the scientific community, we're also seeing in our own community where, for example, at McMaster University, some of our researchers in engineering are working with local companies to design new ventilators and increase equipment and needs that the frontline workers at the hospitals are needing. We're hearing examples of medical students who are still in school and so are not practicing, offering their services to help the frontline workers who might need someone to do a grocery run. So, as much as we hear about all the negativity, there's been a lot of really good things that we see happening too. And it's certainly something we see on the science side. We see it, from the university perspective within our university community. So, those are things that I really would like to highlight and, really give a shout out to all of those that are, going above and beyond to make something that, for many is very tragic and very scary into a really good example of what humanity is all about.
Dr. Mossman, I want to thank you so much for your time today and enlightening us about some of the science behind this virus and your efforts.
Thank you very much.
That was Dr. Karen Mossman, who is a professor of pathology and molecular medicine and vice president of research at McMaster University. That's it for today. Thanks so much for joining us. This Matters is hosted and produced by me, Raju Mudhar, Adrian Chung, and Saba Etisaz. Produced and mixed by Sean Pattenden, and our director of programming is JP Fozo. Our show theme music is by So Called, and our episode music is by Mike DeAngelis. We want to hear what stories matter to you. Please send us comments, questions, or ideas to thismatters@thestar.ca. Please consider supporting the journalism the Toronto Star newsroom does at thestar.com. And don't forget to subscribe to This Matters on Apple Podcasts, Spotify, or wherever you listen to your favorite podcasts. Let's talk soon.